Good morning,
Okay,
sir.
good morning. Good afternoon, whichever one it is. Professor Paul, is it morning or afternoon or noon? It's noon.
Afternoon.
Good afternoon.
So what do you say? Is it good noon or good afternoon?
Good day.
Good day, sir.
Good day. Good day. Good day. Professor Animi, can you hear us? Professor Animi.
Good afternoon, sir.
Yes. All right. So, Dr. Uzo, are
Yes,
your
sir.
other colleagues, have they joined us? Dr. Kafayat, Kodri, Vivian Madu, Lillian Uche, and who else on your team? Habiba, Tricia, Abdullahi. Okay. Let's commence by a 1-minute opening prayer as item number 1 on our agenda. Item number 2 on our agenda for this meeting will be introduction of participants. Item number 3 on the agenda will be 3 to 5 minutes presentation update on the NIAL's monitoring of national response measures to COVID-19 in Nigeria. To be led by Dr. Uzo Prince Oparaku, then Vivian Madu, Lillian Uche, Dr. Kafayat Kodri, Barrister Ijoma, PAS, Information Publicity, and then her colleague, PAS Press, Habiba Tricia. So we have 2 segments of the assignment that I gave out, just for the information of all. I gave out 2 assignments in the last, I think, 5 or 6 weeks, or thereabout, to 2 working groups. One is to monitor national response measures to COVID-19 generally. And that is the one that Dr. Uzo Prince Oparaku is leading. The second component, or the second committee, is actually being led by Barrister Ijoma, PAS, Publicity and Information in Abuja, monitoring the media coverage of the national response measures to COVID-19. Are they misinforming, misleading, or they are helping in understanding the issues and the subject matter? So, for those of you joining us outside these 2 committees, this is what you should expect from the 6 lead participants or speakers. So, you're all welcome. Can we observe just a minute silence to pray in our various denominations in just 1 minute? Amen. All right, introduction of participants. Can we start with any professor or any director that is on ground? Then the key speakers will actually follow their introduction. Feel free to take the floor, please. Professor Paul.
Thank you, DG. Good afternoon. Paul Idonigi is my name. I'm glad to be here again this afternoon. Thank you very much.
Thank you for joining us since yesterday. Yes. Any other professor around? Head of library. Go ahead. Director, admin, general admin Lagos. Go ahead.
Good morning,
We don't know you.
My name is Sena Konjeri, my Director General Administration. Good morning, all. Thank you, DG, sir, for this opportunity.
Okay, good day. Thank you for sustaining your participation since yesterday. Next.
Thank you.
Yes, head of library.
Thank you, DG. Good morning, DG.
Yes, good day.
I'm happy to be here, sir. Thank you, sir.
Okay. Okay. Dr. Uzo, introduce your team. Yes, go ahead.
Good morning, DG, and good morning, Professor Director Administration Lagos, Professor Idonidi. But sir, please, Professor have not introduced herself. you please go before.
Give us your full name that you are coordinating health law and policy project of NIAL. Yes, go ahead.
I'm here. Yes.
I'm here.
Is that Professor Animi?
Yes, sir.
Yes, sir.
Yes, Didi.
Okay, you can you be a little bit more audible?
Sorry, Didi.
We don't know you. Yeah.
Anime Esther Silvanos, Director of Glegville.
All right. Thank you. Okay. Another person can introduce himself or
Good morning.
you.
Okay, I'm just trying to get to. I will look for the video. I'm using audio.
Okay, no problem. No problem. Yeah, you are audible enough. You are audible enough. That's fine. Next.
Okay, sir.
PAS, information and publicity.
PAS editorial.
Okay, thank you for joining us.
Good
afternoon, sir. Good afternoon, sir.
Yes, good day.
Library. From the library. Well,
okay, thank you, Dr. Uem. Yesterday, your background was very noisy, so today, control your background.
All right, sir.
Okay, next. Uzo, we didn't hear you. Okay, good afternoon. Go ahead.
This is a member of the COVID-19 monitoring team.
Lillian, can you be more audible?
Okay. Hello. Okay. Good afternoon, Didi. So this is Lillian, a member of the COVID-19 monitoring team.
All right. Thanks for joining us.
Thank you.
Who else? I think we've actually heard all the 6 participants already. They are on the line. So the item 3 on the agenda of this meeting is update from the 2 committees monitoring national response measures to COVID-19 in Nigeria. The first 4 research fellows focusing on the national response measures. The last 2 participant speakers, Ijeoma and Habiba, will be speaking to us on the role of the media. Are they misinforming, or they are doing their best to help in understanding the pandemic and then the measures? So let's start with the first group of 4. Each one of you will speak for 3 to 5 minutes. So, Dr. Uzo Parako, you have the floor. Give us an update as to how far with your monitoring. What trends have you observed in the national response measures? And then towards the end, you can help us actually with an undertaking that you will give us a timetable by which you submit your interim report, and then a revised timetable by which you submit your final report, hopefully in June. Okay, so Dr. Uzo Parako, you have 3 to 5 minutes. Take the floor. Okay, Dr. Uzo seems to be lost. She was on the screen before. Vivian or Lillian or Dr. Kafayat Kadri. Can any one of you take the floor? 3 to 5 minutes? Yes. Lillian, Kafayat, Vivian, Dr. Uzo, we are still waiting for her to.
Okay, DG, let me come in. I was assigned, the teams were broken down, and I was given to look at the policies of government concerning responses to COVID-19. I was also asked to look at the human rights dimension and the enforcement of the orders. There are quite a number of things I have here in terms of state responses, but I think most of the states showed the same line with Lagos State that was the first to respond in terms of the lockdown order, which was subsequently followed by the federal government's directive. And in terms of the first execution, the first victim here in Lagos was the popular actress Funke Akindele, who flouted the lockdown order when she threw a birthday party for her husband. She was arraigned before an Ikeja magistrate court and was fined 100,000 naira fine and community service for 1 month. There were also several other violators alongside who were confined.
Okay, Vivian, we'll appreciate, since you have 3 to 5 minutes, we'll appreciate if you can show the trend of the state orders and circulars. What is the nature of that trend? And then if you also want to pick on the second issue, i.e. compliance, monitoring, and enforcement measures or approach, then you can bring in examples of violators. So let the theme and the trend come out clearly first before the examples. Go ahead. Or go ahead with the way you prepared your 3 to 5 minutes. Yes, Vivian, we are waiting for you.
I think it's
okay.
From her angle.
Out of Lillian or Kafayat or Uzo? Okay, Lillian, take the floor.
Yes, teacher. Okay, the assignment you gave us, I handled the health and financial response to COVID-19. So in doing that, we looked at the states, the federal government. So, but for the federal government under health, states, I noticed that they had a pattern. The health response followed the pattern. Well, due to the peculiarities of the state and the burden of virus in the state. So, for instance, the state down, but began to gain control and confidence. To gain control and confidence, they started to lead the order while the response. So another thing I noticed was confusion in the public health directive, because some people about the NCDC health advisory. Some went ahead to develop their own health advisory. For instance, the 2 meters person distance that was advised by NCDC and WHO. States like Abia State, for instance, gave their own advisory to observe 1 meter distance. Also, why the NCDC advised that the remedy to infection spread was to stay at home, a state like Cross River State said no, that for them it was just the use of face masks. And therefore, he ordered workers to resume work, but made the use of face mask mandatory. So still on health, on easing off or the easing for the lockdown, you notice that some states actually yes drastically. For instance, Abia State, Delta State, Anambra, the moment they eased off their lockdown, they opened up the public places, they allowed churches to hold more markets and all without restrictions. But some states like Lagos are having a gradual easing of restrictions while still maintaining the curfew. So more importantly, level of unpreparedness I noticed on the part of the state, because before the spread went to states, we learned other states were all saying what they have done, what they have put in place, their isolation centers and all that. But by the time their state got infected, we realized that they had nothing on ground, that they never put anything in place. Then on finance and finance. So I noticed that states actually came out with interesting stimulus packages for their citizens, such as loan moratorium on businesses, even though almost a non-existent interest rate for SME. Some states started implementing micro projects across communities as part of a multi-sectoral intervention. Well, for some others, one important example for a state like Lagos, who understood the times we are in, and more specifically, they encouraged startups like tech startups by placing the moratorium on their loans and even calling people who are into technology to come and take loans, free interest loans, and all that. Another one, a disturbing factor in the whole stimulus package thing was the fact that it was uncoordinated. The only coordinated one was actually the CBN, one that was domiciled to CBN by the COVID fund. That was the only coordinated one. So as such, it was difficult to actually document all the stimulus packages because some NGOs and CSOs just giving their creative in their different communities and all that. So as such, we couldn't document all what was done. Then another experience I had is that institutions weren't sure of what they wanted as stimulus package. So, and as such, they kept on giving conflicting information to the public. For instance, in case of MBA, an organization like MBA first came out and said they were returning 10% of our bar practice fee, all the branches. Some weeks later, they changed information to say that, okay, all the branches commit names of their young lawyers 1 to 7 years, 10 other names of members and death palliative. So that's all the information available to the public. Then one important thing was the sectoral intervention that we noticed, such as, for instance, in the in the education sector, the development learning portal. So that the multi-sectoral interventions that we noticed. So I think my
All right, thank you, Lillian Uche. This is a very good presentation on the sub-component assigned to you. Do we want to make some comment or ask some questions, or we take the remaining actually speakers before we intervene? Democracy.
Yeah, I think I should
Miles Public Health Law Research Project. And but I will want Mrs. Madu to speak, then I will tie it up with the rest of the subject.
Okay, Vivian Madu is not is not connecting. I don't know whether she's ready now.
Okay.
If she's ready, she can take the floor.
Okay, I can. She's here, even though her mic is muted. Mrs. Madu, can you hear us?
Vivian Madu, we can't hear you. Uzo, take the floor now.
Yes, sir, no problem. I will start from the background of the project. Nigeria being the kind of country it is, as a third world country with a fledgling healthcare system, the whole world is watching or was watching as the breakout of this pandemic to see exactly how Nigeria was going to respond. Even though we have a track record of responding, adequately to the outbreak of Ebola, but Ebola was different in that Ebola had a different when persons who contract Ebola are able to infect other people at the onset of symptoms, as against COVID-19, where people who pick up the infection are able to infect others even before, or they may not even have any symptoms at all before they are able to transfer this infection to other people. So the world was watching to see exactly how Nigeria was going to respond. And the WHO even released a statement in Nigeria with the level of contact we have with China, that we are an interesting hotspot in the making for COVID-19. And when eventually we picked up our index case on the 27th of February, so it was like the clock started ticking. It was, bodies falling on the street. But the country has managed to, keep these numbers low, either because of our own climate, which has not been proven that is the case, or because we are not quite testing as much as other countries have. We are lagging much more behind in our own countries in our testing capacity per day. One of my relatives picked up an infection and was dying, and we tried to call NCDC, and they didn't know what to do. They couldn't tell us what to do. And these relatives actually died. So,
Dr. Uzo.
Yes, sir.
Dr. Uzo.
Yes, sir.
Please focus on the main assignment. We know the background. What we want is your monitoring of the national response measures to COVID-19 in Nigeria. Look at the way Lilian Uti gave the presentation. That is the kind of template we're expecting you to give in 3 to 5 minutes. We know the background and the context. Give us the role assigned to you in terms of monitoring national response measures, not the background.
Yes, sir, that's fine. I took over. I was wanting to speak to all the issues assigned to Dr. Kadri and myself, so I had the background. So I wanted to speak that what she was supposed to do too. Yes, sir. I was supposed to also speak to the objectives and the goals. Because of the varied way that the responses were being released from different quarters, I believe that an important objective for the monitoring of the responses was to have a repository of these responses as they were handed down by the different levels of and we divided those responses into different sub-things. With Mrs. Uche have spoken to us on public health policy responses and financial / stimulus package responses. I am supposed to handle administrative and institutional and legal responses and the responses together as a subhead. In regard to the responses, we have tried to tabulate them separately and then to have a prose presentation. And under legal, we discovered that when the federal government came up with the COVID-19 regulation 2020, the very first regulation, the states started scrambling to have their response to, because the regulation addressed more or less Lagos, Ogun, and the FCT, locking down those locations, declaring COVID-19 as an infectious disease. Several states, particularly Lagos, as a premier state in the response to infectious diseases coming from Ebola, released its own regulations, empowering their governor to spend an amount to be released by their legislative arm to handle the responses. And states like Enugu, Cross River State, Abia State, Ogun State released their own regulations, but they were more or less identical with the national regulation, and that is not surprising, going from the Quarantine Act that empowers the states and the state governors to make regulations for locations in the country where the president, that's in Section 8, where the president have not made regulations or handed out guidelines for those particular locations. And once the regulations were in place, it became an issue of response and compliance for the citizens, for MPs. And starting with the head of service, he released a circular, requesting for a particular level of staff to stay at home, and Lagos State and other states followed suit to requiring staff of a particular cadre to be home, and eventually every staff was asked to stay home, including our own very NIAB. A particular level of staff was level 12 below, but had to stay home, and eventually the rest of the staff, everyone was asked to either report on a very level, like 3 days a week, or not show up at all. With regard to administrative, we saw that different MBAs were releasing particular directives for their staff on how they should show up, what should happen, what should not happen. And institutional, we saw companies like NMPC, INEC, in different places where elections were supposed to hold. Okay. Those elections were postponed.
Now
released directives
regarding. This is meeting controls. Do you have to stop?
Yes, I can hear somebody speaking loudly. Release controls about.
It's Professor Adioko. Thanks for joining us. Go ahead.
Yes, I'm still on institutional. Then Lagos State Ministry of Health released a directive launching eco telemedicine, requiring citizens in the state who are not in critical state to call in and be attended to by doctors on the phone. Kaduna State, almost every state set up mobile courts to enforce and to try, who were in default of regulations for the COVID-19. And then regarding human rights violations during this time, the Human Rights Commission released a statement on the 14th of April that they received 105 reports of human rights violations across the state, and that they have investigated most of those. About 80% of that have been investigated, and they've been handed over to law enforcement to continue the enforcement, the prosecution, and bringing remedies and to the persons who their rights were violated. But what I find most interesting about the responses was what hampered it the most was the lack of a national data for citizens generally and a national welfare register. Like what Mr. Muti said before I went off because of power, he with these the stimulus packages was so sporadic because we didn't have a reliable data to distribute the response, have a national response to poverty and hardship and hunger during the lockdown. And again, because of the way our markets are in Nigeria, it was difficult for law enforcement to bring people to respond appropriately to the directive that we can safely engage during the lockdown. And these things have been, has hampered the effective release of stimulus packages. And again, administratively, regarding the markets, on the days they are supposed to open, I also came across reports and data on people still able to operate in the markets, even though the markets were closed. And that means that more people were on the streets. And it was almost impossible for law enforcement to regulate how many people were on the streets, causing traffic jams, causing so many people on the streets at the same time. And that again hampered administratively the responses put out for COVID-19. And
all right, thank you, Dr. Uzo Prince Okparaku. Initially, I didn't know that you were combining that of Kafayat was indisposed and your own. That's good. So, can we listen to Ida, Barrister Ijeoma, and then Habiba, 3 to 5 minutes each? Ijeoma, please, you have the floor. Is Barrister Ijeoma around? PAS, Information Publicity.
Can you hear me, sir?
Yes, you can hear you. That's the second complaint. Yes, go ahead.
All right, sir. Thank you, DG, sir. My team was given the assignment to monitor the role of the media in documenting federal and state government responses on the COVID-19 in Nigeria. The last few weeks have been, there has been an upsurge in information, both right and wrong. But my experience has been a mixed grill. So far, we have been making our various implementations based on the NCDC information response and the PTF, which we believe is more authentic. I have realized that we were ill prepared for the pandemic because our health sector is in shambles, despite the fact that we had a 3-month window to prepare. We also took things for granted, typical of our national lifestyle. We assume that the plague in Wuhan, China, will not spread to Nigeria. The only state with a state-of-the-art facility is Akwa Ibom, that had the specialist hospital in Uyo. And when the virus eventually knocked on our doors, we did not have enough testing kits, protective equipment, gears, enough bed spaces and isolation centers nationwide. From the testimonies of discharged patients, it's becoming obvious that there are errors in our diagnosis. There are errors in our diagnosis, especially some of the hospitals are treating malaria symptoms as COVID-19 patients. Yes. You may need to read the revelations of some of these discharged patients. One is the former spokesperson, presidential spokesperson, Okube, and the other one is the owner of Dark Communications, Ray Dobesi, Chief Raymond Dobesi. But my tracking has also shown that we have capable human resources, that is manpower, to contain the virus, as evident in the low death rates. As at Monday, we had 191 deaths recorded in the data by NCDC in the country. Lagos is a successful case study. Our major setback, however, is that we do not have enough doctors on ground You know, take for instance, in the northern eastern parts, and also from some of our media people that I have, you know, asked questions on their monitoring experiences. They are saying that enough awareness campaign was not issued at first until very lately, where people like Governor Yahaya Bello, Ben Ayade are believing that the pandemic is not real. According to them, they said the virus is not a not prevalent, is not as prevalent as we were made to believe initially. Nigeria has paid lip service to a leeway to go to markets, you know, based on federal government's directives for markets to open on a certain number of days. The crowd there is alarming, and if there's COVID-19, it will spread so fast. Many public places do not have hand washing facilities or sanitizers. I think it is also in our. Yes, sir.
Can you help us relate all this to the role played by the media?
Yes, yes, ma'am. Okay. The media so far have been giving us more of their response has been very authentic, because they are getting their information from NCDC and PTF, and they are acting as a third response team, more like, where they are not going outside of these major information outlets to give us their own perspective of how things are being done, and
what of the social media, part of the larger definition of the media?
The social media so far has been giving us majorly, is a mixed grill. They've been giving us both authentic and non-authentic news, and but so far media has become a bridge, between federal governments of the Federal Republic and the states, on information. That's major kids. They are just standing as a bridge between the federal government information given from the PTF and that of NCDC.
Okay.
Yes,
Habiba, can you take the floor? Complement Idioma's presentation.
Good afternoon, my dear colleagues. Okay, I'll say my colleague Ijeoma has virtually said everything, so I have very little to contribute. What I'll say is that as she said earlier, the media has given us a mixed grill in reporting, because there are both positive and negative attributes to it. They give us the facts, and then at the same time, there are some information that they give us, and we don't know whether they are really authentic or not. Since the disease is a novel disease, it's the first time the world is coming contact across it. So we don't know how genuine or real the information is. For example, now, a positive attribute of the media is like social media is during the burial of late Abba Kyari, people that participated, some people discarded their PPE not appropriately, and some people that were watching from a distance captured this thing, and it was aired. Sorry, it was trending on social media. Before we knew it, the appropriate authorities saw this thing trending, and then they called the right authorities, and then these PPEs were discarded and the scene was disinfected. So the social media played a positive aspect in that role. If not, only God knows what would have happened, because we don't know whether, from what is happening now, we don't know whether corpses can really transmit these diseases or not. So it said that you cannot contact the disease from a dead body. Then another thing is NAPTIP informed us that due to the lockdown, there has been increased rate in domestic violence. You know, maybe some couples are not used to living together, or their husbands are used to going out, you know, that kind of thing. So, and then this issue of people cannot move about, before you know it, they don't have money to provide for their family. Tension everywhere, fights.
We will ask Professor Paul.
Then another thing is that our education system is lagging behind, because in advanced countries, the higher institutions are still operating. They operate this e-learning of a thing. But we in Nigeria, we've shut down our universities and polytechnics since April because we do not have the facilities to carry out e-learning. And then even our primary and secondary schools that are trying to do that, we find out that
on this point, is the media making any contribution to ensure that, you know, we leverage on their platform, on their media platforms or education or whatever?
Yes.
From the monitoring.
They advertise.
Yes, the media is leveraging on it to give daily briefings, you know, by the presidential task force led by Boss Mustafa, the Secretary to Federal Government. Without the media, it would have been a different ball game, because they have helped to cascade information down even to the locals, to the villages, you know. Yeah. And I would say the media has contributed positively.
They have contributed a lot, because when you watch the TV or listen to the radio or social media or even on our phones, we do get information daily. So at intervals, there's no platform you don't look at that you don't get information about the disease or the measures that governments take. So I say the media is playing an important role.
What of the media providing platforms for educational purposes in this period? Did you monitor that?
I know that they do advertise
some states are claiming that they have started e-learning via radio, via TV.
Yes.
The media platforms necessarily available for them. Did you monitor that?
No, I did not. But what I saw on DSTV is that they advertise these e-learning apps that one can download. Then there was a time they had a station that they asked secondary school and primary school students to key in to be educated or receive some lessons.
Okay. Yes, Ijeoma, go ahead.
Yes, sir. Like she said, DSTV already has some stations, that they have made available for e-learning purposes, and they have made this information available to schools, especially secondary schools, for those that are about to take external exams. You know, so Also, I think NTA has a station too. And then on social media, there are apps for e-learning purposes. And, you know, they're encouraging members of the public to put their children online to learn, you know, instead of sitting idle without, you know, and wasting away, so that they don't lose the trend of what they're supposed to know.
All right. All our 6 principal speakers have taken the floor. We thank them all. The floor is now open. Professor Paul, Professor Animi, Dr. Uwem, Dr. Olocha, and I saw Professor Adiopo join us 5-7 minutes ago. So please take the floor from wherever you are. The floor is open. Question, comment, or any contribution?
Okay, thank you, Deji. I see this as a preliminary report. I'm hoping that at the end of the exercise, we will have very specific recommendations. For instance, on the issue of palliatives, this is one area that people are complaining that does not go around, or one particular area is favored and all that. Then the issue of interstate movement. Now, despite the lockdown, people are still traveling. They are still moving. Yes. You can see people traveling even from Lagos or Abuja. You ask yourself, where did they pass with the lockdown? So like I said, I think that at the end of the exercise, I want to comment
they went through cyberspace from Abuja, from Lagos to Abuja, cyberspace. They Zoom.
Then lastly, DG, on the issue of the Quarantine Act, this was a law passed in 1926. I think that at the end of our work, we should make a specific case to support the bill in the House now, insofar as the bill meets our requirement and the human rights issues that are being raised there are addressed. Thank you very much.
Thank you, Prof. Professor Animi or Professor Diopo or whoever is there, take the floor. It's open.
Thank you, DG. This is
yes, Professor Animi, please, you have the floor.
Well, yes, Prof. Yes. Thank you. I listened to the submissions, but I don't know whether it's the network or something. I wasn't really hearing what the presenters were saying, but based on how the presentations were made, I think they need to actually itemize and highlight the submissions that are being made. So everything that was said one block of information, and if it's a report, that's not the way it should be. So we should be able to see the various issues highlighted under subheads so that we can better appreciate what is being said. That is one. Then secondly, I think in line with our mandate as a legal institution, we should do something more detailed in the area of human rights abuses under this lockdown situation, because that one is quite
Who am I talking?
Go ahead. Okay.
Yeah, I don't know if my contribution is going to go alongside others, because I thought we were going to talk about the things we see on the ground. about the role of the media to curbing this COVID-19. I have not really seen them. They do positive jobs and they do negative jobs. For example, what of the index case in Benue? The woman up till now says she does not have. And they keep saying she has, and she's been quarantined, meanwhile she does not have. What does the media really do there? Is it positive or negative? Is it positive or negative?
The report.
It's a report. Is it positive or negative? Which one are we talking about?
Allow to finish.
Yes.
Dr. Owen, finish.
Again, I also want to ask. Now that there were some people that did this party, I had heard one of the discussants talk about it, and that she was fined 100,000 naira and given community service. What of those that have been organizing things like that since then? What has been happening? So what is the media telling us about it? That is number two. Number three, the first day they said they have eased this lockdown in Lagos. If you saw the hold up on Third Mainland Bridge, what did the media or the government do about that? I live in Surulere, and when we want to go out now, the hold up is like it has always been. The media does not even report this. What do? We must wear face mask. Or I come from Cross River State, and when you don't wear face mask, according to my governor, you pay 10,000 naira fine. So everybody wears face mask. In Lagos, the media does not do anything about it. You go about your business, you go to where you want to go, and you come back from where you want to come back from. And nothing is being happening here. I don't know if I am really talking out of what we are talking about here, but my own reality is the things I see every day. And we are about to go to work. And when we want to start work now, what will be the rules we will follow and how? Thank you very much, DG, sir.
Thank you, Dr. Owen. Next, the floor is open.
Okay, please let me answer her.
Okay, go ahead.
In respect of the media covering it, I believe the media also involves social media. If our TV stations or radio does not cover this thing, I know I live in Abuja and I saw that the hold up on Third Mainland Third Mainland Bridge. I saw that on social media, Facebook to be specific. By 6 o'clock, after the ease of the first lockdown, the hold up was something else. It was something else. By 5:30, the hold up was something else. So when we talk of the media here, it doesn't necessarily mean just TV or radio. If they don't report it, it's being reported on social media, and it's still part of the media. So I believe they are reporting it to what COVID-19 or the issues are.
Can I also chip in?
Next person. Yes.
Can I chip in? Regarding the Benue Index case, if it were not for the media, nobody would have heard it. She had her phone and she was able to record herself to tell her own part of the story. And up till now, the media is still carrying it on. And for that fact, it has gone to the Senate. NCDC has set up also a panel to look into her matter, which they have been reporting alongside their daily reports. We are made to understand that so far the woman has accepted to undergo another test, you know, as at I think the day before yesterday, you know. So media is doing a positive job. Where we have issues mostly is the social media, but the mainstream media is filtering that, you know, to reduce the amount of fake news, the amount of fake news that is out there.
Okay. Yes, any other person can take the floor. I saw Professor Adiopo joining, some other persons joining us. They are free to take the floor, 1 minute each. Otherwise, we'll give
Dr.
Uzo an opportunity to. Yes, go ahead.
Thank you, DG. Thank you, DG. Can you hear me, sir?
Yes, please go ahead.
Yeah, thank you. I just want to say I had some technical issues and I'm actually following on the discussions. I think we're on course. I mean, the point has been made by the speakers that media has very important role to play. And we continue, our team should continue to monitor that. And most importantly, related to the activities of NIAS, which is really my main concern, and how we should respond to that and operate. Thank you, DG. Thank you.
Thank you, Prof. You missed the part of the first 4 presentations by the monitoring of national response measures group. Dr. Uzo, Dr. Kafayat, Vivian, and Lillian Uche. But it's still okay. You made the second part on the media coverage. So we have 2 committees. One on the coverage, monitoring of the national response measures to COVID-19, and the second committee is on the role of the media in monitoring national response measures to COVID-19 in Nigeria. All right, is there any other person that wants to take the floor?
Yes, sir. DG, sir. Good afternoon, sir.
Yes, good afternoon, please.
Good afternoon, everybody. This is John. Yeah. Yes, sir. Well, I just want to contribute, even if it's on a comparative note. Being here in South Africa.
From where are you calling from?
Okay, I'm calling from South Africa, sir.
Thank you for joining us.
Yes, sir. 2 main things have actually caught my attention in the cause of this COVID-19. First of all, I noticed that in South Africa, when they said lockdown, there was a total lockdown of all the provinces. But I noticed that initially in Nigeria, some states will lock down, other states will go about their businesses. And I felt, that it just wasn't right because, I mean, the spread of the disease that they were trying to control wasn't adequately being controlled with that system. I expected them to have a total lockdown, which was what they did, I think, in the last 2 or 3 weeks. They should have done that initially because that was what they did here in South Africa. And then secondly, I noticed also in terms of education, like here in UCT, they gave us all free data to all the students, so that you can access whatever is being done from anywhere, so that you don't say you don't have data to join, what the school was offering. And then there was a lot of program going on Zoom. I've been having lectures, I've been having meetings with my supervisor and all other professors who've been doing a lot of Zoom meetings, and education here has also been going on. For those in the university, the undergrads have been having their lectures. It's as if nothing is happening. They've been having Zoom lectures. In fact, right now they are writing their exams. But back home in Nigeria, my kids are at home, nothing is happening. Those of them that are in the university, nothing is happening. They can't key into, any online lecture and all that. It's painful, but I'm just hoping that Nigeria will learn to, invest more in education, so that when things like this happen, they don't lose out completely. Children don't lose out completely. That's just what I want to chip in, so that we can learn, from what is happening across the world.
All right, thank you, Ijoma from South Africa. But I also want us to note that the fact that there was a total lockdown of all in terms of mortality rate, the number of infected persons, the number of persons also on active case points, that Africa, as at today, is about 10,000, figures ahead of Nigeria. Nigeria recovered about 16,000 plus, while Nigeria is around 6,175. So I think each country is expected, from the guidelines by the WHO, forced to do a national risk assessment, which each country did. So from the national risk assessment, you can now begin to tailor your guidelines and your response measures, public health response, legal response, policy response measures, physical response, monetary response measures. So we need not necessarily have the same template of national response measures. When you are talking about lockdown, many countries in Europe, in America, did not totally lock down all the states. So first, you select from national risk assessment, you lock down, you lock down in phases. So South Africa might have taken that measure because of its national risk assessment, data, and that actually is justifiable. So I know that we might. The question I want to sound to all of us. So at times, comparison of some countries in terms of national response measures may not necessarily work perfectly, but it's good to keep on drawing lessons. So if there was a total lockdown of all people in South Africa, what is the explanation for South Africa having about 16,000 plus active cases today, while Nigeria has only 6,175? If you go also, if you set the numbers against the population, Nigeria is the most populous country in Africa, and why are we having 6,175,000, 6,175 as opposed to 16,715? And then on mortality rate, why are we having less than 200? And South Africa is already approaching 300 mortality rate. So at times, the coverage, the national response measures to COVID-19 is not necessarily about the game of numbers. I think at times we are missing the point. It's about, based on the national risk assessment, based on the facilities that you have, based on your design national response measures, what can you achieve and what is it that you can draw up plan, and what can you also do to continuously revise your strategy to see what works and what does not work. For instance, Dr. Uwam raised the issue of what she has been seeing every day in Lagos with regards to non-compliance and non-enforcement, of some basic guidelines issued by the NCDC and the PTF, i.e., wearing of mask, social distancing, and then avoiding, mass, mass movement in terms of transportation. So this is a compliance, monitoring, and enforcement response problem that Nigeria needs to work on. And that is a component of a national response measure based on a national assessment. So I think we've noted your observation regarding South Africa, and it is also very important for us to understand that some comparative analysis may not fit in and may not work. So we have to really leverage on some key indicators. The indicators that can work for comparative analysis, we use them. The ones that should respect national risk assessment, against national response measures, we should also take cognizance of them. I think one lesson that I have actually drawn from the COVID-19 national responses at the global level is that every country is on its own, even though there's a minimum WHO benchmark for them to follow. Yes. All right, we'll be rounding up because I have a second meeting. So, Dr. Uzo, if you have listened to all these discussions, and Barrister Ijeoma, we'd like to thank all of you for joining us. Is there any person who wants to speak? Just 1 minute before we close.
I wanted to mention, for those who returned considered reports on returnees from overseas, some of them from the diaspora, and whether they were quarantined and whether or not there was any contact tracing for them. Okay. Because they came back, they just went back into their various destinations. Is there anything about checking where they went, were they quarantined or not?
All right, Dr. Uzo, Professor Ijoma, did the media put their searchlight on these returnees or people from diaspora, especially through land borders survival? Yes, go ahead.
Yes, sir. The press has been following up. The press has been following up on returnees from foreign countries, and that has informed the contact tracing being very effective since the COVID-19 began in Nigeria. So the press has been on it.
I know that some state governors like Osun and Oyo state governors had issues with citizens returning through land borders. So they started subjecting them to, they issued a kind of order to quarantine them and to also ask some of them to be on self-isolation for the mandatory 14 days period. How effective that has been at the state level with regards to persons in the diaspora returning via land borders or returning via airlines. I think the easiest ones are the ones in the last 7 days or so that returned from Dubai, from other countries. I think it was easier through Abuja and Lagos to quarantine them for 14 days mandatory period according to the guidelines. So I think the media put searchlight on them, and also the federal government and some state governments tried actually to quarantine them, and then tracing are ongoing. What I am not sure about is citizens returning through land borders. So far, only Osun State had a searchlight put on that state, and they were able to report the number that they have successfully quarantined from land borders into the state. Any other person who has not spoken to say a word in 1 minute? Otherwise, Dr. Uzo has 1 minute to round up. Have another meeting.
Okay.
Okay, Dr. Uzo.
Yes, if I may speak first to persons returning through the land borders. The national coordinating team actually took over that, particularly on the Badagry border and the Sao Tome border and Republic of Benin, Togo. They negotiated a pass through Togo, where about 27 citizens were stationed in Togo for a while at a cost to Nigeria, and Nigeria had a hotel across the border, right outside the border with Togo, where they were quarantined, and also in Badagry, about 60 of them who came into that border, and they had hotels that Nigeria paid for that they were quarantined in. But after that, Nigeria changed its policy regarding that going forward, if you choose to return, because they are saying, don't return, stay where you are. There are response mechanisms everywhere. You don't have to use your country's mechanism. However, if you're having visa issues and there are no extensions where you are, if you choose to return, you will pay for your quarantine. And I haven't seen much on that regarding that in particular, if they were made to pay or if anyone has returned after the people who came through Badagry, Tome, and then Togo into the country. And then,
all right. Thank you very much for your participation, all of you. I am having another meeting 1 to 2. Thank you all. I would like to say that the deadline for submission of your interim report is now extended to 1st June. And your final report will be June 7th. Thank you.
Thank you.
Thank you, sir.
So,
thank you.
All right, thank you. Bye-bye. So those of us that are interested, you can join us meeting, or tomorrow we are having another meeting 12 to 1. It's going to be, the speakers are going to be Professor Deji Adekunle, Immediate Past DG, Professor Francisca Nlerum, Professor Ngozi Udombana, Dr. Irekwitan, and one other person, I've forgotten. So they are going to, actually, it's going to be on e-learning and also on PG program, as well as on clerk courses on how can we be on digital, arrangements. So join us on Wednesday on that, 12 to 1 on the e-learning platform, and also on PG programs, how far we can go digital at NIALS. See you at 12 to 1 tomorrow. You can join us at 1 to 2. Bye-bye. I have another meeting. Thank you very much.
Thank you, Didi.